So today I just wanted to touch on oral care actually, because that is a huge thing when you're going through any kind of cancer treatments like chemotherapy. It tends to wreak havoc on your mouth because chemo tends to target fast growing cells, like cells that quickly reproduce. And that's why your hair falls out. Those are faster growing cells. And the cells in your mouth, your throat, your stomach, all that is kind of connected. So basically, when you're depending on the kind of chemo that you're getting, it can be very like hard on your mouth. Like you can get mouth sores, ulcers. They can prescribe you special rinses. It can get really bad. I've had chemo twice in my life now. I had it in 2015, and I remember every time I would get get the chemo, within a couple days I'd feel the sores all inside my mouth and my gums. Like it was awful. Like the feeling is terrible. You get thrush in your mouth, you can't taste anything, everything's disgusting. And the same thing happened this time. Like not with the first treatments that I had, but with the second set of chemo that I had, that one I knew it was coming because I've had it before. So it was bad. It and then I lost my taste for a few months. Things just didn't taste right. But you can't go to the dentist while you're doing your treatment, only because they're picking and poking in there and stuff. You can't risk getting an infection. You just may not be able to fight that off. So you have to wait till you're done. So I would say in the last, I think it was around 2021, I decided that I wanted to get Invisalign for my teeth because, and they're not terrible, my teeth, but there was just a few things I wanted to like straighten out and whatever. So when I went and had a consultation at my dentist's office, we were talking about like, how my bite was and stuff, and they wanted to like widen it and straighten it and all the whatever. By the time we finished doing my x-rays and stuff like that, I had both dentists say you can't have your teeth, you can't get braces because my teeth were literally from the inside, like there's holes inside my teeth. And that's just from the chemo, the damage it's done, like it's like disintegrates your bones. And then you have gum loss too on top of that because my teeth are losing, like I'm losing the outside of my teeth, the inside of my teeth. So it's not actual cavities that I have. It's just like almost from like the inside out, to the point where they had to fix, I had a bunch of cracked molars I had to put crowns on. I spent a small and I have benefits that cover things, but I just blew through those benefits within like the first month or two, and I didn't have a choice. I had to get my teeth fixed. I had to get all the things fixed. And this was from like the last time I did chemo. I think over the years. And I've gone to the dentist over the years, and I I don't know. It just kind of did damage to me. So it and I take care of my teeth. There was literally nothing you can do about this kind of stuff. It just happens. So this time as well, I took care of my teeth. You brush, you floss, mouthwash. I had a water pick. There were some days where it was really hard to brush your teeth. So, like, my suggestion would be get a toothbrush with like extra soft bristles, because some days, like, it hurts to brush, and you're just like barely, like, you're probably not brushing your gums sometimes because of the pain of the sores everywhere. So I would just like, some days I'd have to just like lightly brush my teeth as best I could. You can do like a baking soda and salt water rinse in your mouth. So I was doing that a few times a day. I don't know if it was really helping. I feel like nature just ran its course. But yeah, definitely something like people don't really think of, and nobody really tells you about this. Like, I don't think the doctors really tell you like, hey, your teeth are going to be like garbage by the time you're done this and continue to be garbage. So I kind of was like, well, you know what? I had money put away for braces. So I guess I'm just going to save that money and use it for dentures down the road, because that's probably where I'll end up. I'm very like, I don't eat anything really too crunchy. Like, I'm terrified to, because I know my teeth just can't handle it. And they've showed me the x-rays, and they've explained to me these x-rays. So like, I know there's more pockets in my teeth that it is what it is. So I figured at this point, we're just going to take care of them as best as we can. Like I said, the outside, like they look fine. They're like I always get compliments that my teeth look white and whatever, and that's great. Like they look fine from the outside, but again, from the inside, they're not doing so well. That just happens, and I think that happens with a lot of people that go through chemotherapy. Eventually you start to have problems with your teeth and stuff like that. I've had to go to the periodontist and do like where they freeze your mouth and do like deep pocket cleaning and things like that. So I use all the things. I use like a soft bristled toothbrush, gentle toothpaste like Colgate Sensitive or Sensodyne, something like that. I don't use anything like too harsh. I can't use whitening toothpaste anymore because there's just the tooth sensitivity is really bad. I can't drink anything. I don't drink anything hot, really. I don't drink hot stuff. Like I don't let it touch my teeth or cold stuff. I pretty much stay away from ice cream and things like that now because I can't. It just hurts my teeth too much. What else? I have to use proxy brushes, which are the little brushes that you like stick in between your gums and like kind of pick through. I have to use those now. And yeah, I just use my water pick and even mouthwash. The dentist said like you don't overuse it because it will it will take care of the bad bacteria, but also gets rid of the good bacteria as well. So I don't use like harsh mouthwashes every day, like Listerine, like with alcohol and stuff in it. Like I'll use those every like few days, but I just use like the TheraBreath breath or whatever it's called. That one's pretty gentle. I don't think there's any alcohol in it. It doesn't burn. So I just kind of stick to that. But yeah, it's something that like people don't really tell you, and maybe it's not really talked about too much. But I thought I would just kind of throw it out there because in case someone's like starting treatment or you probably don't, your teeth are probably the last thing that you're thinking about. They will usually, the doctors will tell you not to go to the dentist. They do tell you that, but yeah, you have to wait. So I I'm still doing immunotherapy, which also can like bring down your immune system, and I'm doing that right till August of 2025. Um, so I'm not going to book a dentist appointment till after, sometime after that because I don't want to get like an infection in my gums or anything. Sorry, and my cats they're all chilling out in my room today and apparently licking their fat bellies. So anyway, I just thought I'd throw that out there, just something to think about if you're starting treatment or whatever. Just try to take care of your mouth as best as possible. If you get the mouth sores, there's not much you can do. Again, the baking soda and salt rinses kind of, I guess, help. But yeah, I would definitely invest in a soft bristled toothbrush, nothing too harsh, probably not even an automatic toothbrush at that, because those can be kind of harsh as well. And just kind of take it easy. And then when you're done everything, definitely like book yourself a dentist appointment if you can afford it, if you can. Get a good cleaning and get them to assess everything too, because it's good to know. At least you can stay on top of it. Like I was keeping on top of everything with all my cleanings and going to the periodontist and getting those deep cleanings too. Now I've had to stop. So once I'm done everything, I'll make some more dentist appointments and kind of see where I'm at with everything. But anyway, just thought that was something people should kind of be aware of because I don't think it's really talked about that much. So anyway, happy Sunday and enjoy your day.